What is cross-tolerance? Have you ever wondered how one medication can affect the response to another? This is where the concept of cross-tolerance comes into play. Cross-tolerance occurs when the body becomes less responsive to one drug because it has already developed a tolerance to another drug that works similarly. This means that if you have been using a medication that affects the brain in a certain way, you might not respond as strongly to a different medication that targets the same areas. In the context of schizophrenia, understanding cross-tolerance is important. Many medications used to treat schizophrenia, known as antipsychotics, act on the brain's dopamine system. If someone has used other substances or medications that also influence dopamine, like certain stimulants or even other antipsychotics, they may develop a reduced response to new antipsychotic medications. This is a clear example of cross-tolerance in action. Cross-tolerance can make treating schizophrenia more complicated. For individuals with a history of substance use that impacts the same brain pathways as antipsychotic medications, their body might not respond as expected. This can lead to challenges in finding the right dose or type of medication that works effectively. In some cases, healthcare providers may need to adjust treatment plans, switch medications, or even use higher doses to achieve the desired effect. It is essential to understand that cross-tolerance is not limited to schizophrenia or antipsychotic medications. This concept applies to many types of drugs, including those used for pain, anxiety, and sedation. However, in the treatment of schizophrenia, being aware of cross-tolerance helps healthcare providers make informed decisions about medication management, especially for those with a history of substance use or previous exposure to similar medications. Addressing myths and misconceptions about schizophrenia is also vital. Some people mistakenly believe that schizophrenia is untreatable or that medications always stop working over time. While medication tolerance, including cross-tolerance, can be a challenge, it does not mean that treatment is impossible. Adjustments in medication type or dosage can often overcome these issues, and maintaining open communication with healthcare providers is key to effective management. If you or someone you know is receiving treatment for schizophrenia and has a history of using other substances or medications that affect the brain similarly, it is crucial to share this information with your doctor. This helps ensure that the treatment plan is tailored to individual needs and maximizes the chances of successful symptom management. Cross-tolerance is just one factor to consider in a broader approach to mental health care, but it plays an important role in how treatment is managed.